There's little more frightening than the wheezing and shortness of breath that comes with an acute asthma attack. Fortunately, asthma attacks can be prevented by staying a step ahead. We went to the Brigham and Women's Partners Asthma Center to look at how best to prevent asthma flare-ups with Dr. Christopher Fanta.
Asthma is a chronic, persistent, ongoing problem with the bronchial tubes, even though the symptoms may come and go.
That's because there's an underlying inflammation of the airways themselves. It may not take much to trigger spasm in the muscle of the airways, closing them down. First in preventing those flare-ups is figuring out what the triggers are. That may require some detective work, starting with a good history by a physician about when and where you get sickest, and then allergy testing.
There are a battery of allergy skin tests that can be done, looking for a reaction in the skin that likely mimics the bronchial reaction of asthma. And there are blood tests available that ask, is there present in your blood an antibody to these specific allergens?
Blood tests are routinely available at most doctors' offices and are used for initial screening of specific allergens or groups of allergens. Skin testing often requires going to an allergist who will narrow down the specifics of which allergens might be causing your problems. Skin testing can lead to other strategies. Avoid pets, especially if you have severe exacerbations that require oral steroids. Clean up a damp, molding basement. Remove flooded carpet with mold. Undertake cockroach extermination in the inner city. Avoid cigarette smokers. Use mats for mattresses. Use standalone HEPA filters. These are very effective, especially for dust mites or in your vacuum cleaner.
One of the problems with traditional vacuum cleaners is they suck up the dust, trap some of the big particles, but the fine microscopic particles can make their way out the exhaust and be blown into the air.
Another preventive strategy is before exercise.
Use your quick-acting bronchodilator 5 to 10 minutes before you go out, and it'll prevent the spasm brought on by that trigger.
As a rule, use 1 canister of reliever medication, that is the bronchodilator, per month. Any more, and your underlying disease may be worsening and should be treated with controller medications such as inhaled steroids. If you think you're getting worse, there's a simple test.
Take out that peak flow meter and blow into it and make a measurement. Just like if you were concerned, do I have a fever, and you'd like to know, is it 99, is it 104 degrees? You take out your thermometer and make a measurement. So too for asthma.
The peak flow should be at least 400 for a woman and 500 for a man. If you're in an emergency room 3 times a year, miss school 10 times out of the year, cancel vacations, or need a daily controller medication or bronchodilator, better prevention will help you enormously. At the top of the list is having an asthma action plan, which is at the heart of treating asthma.